So next I'll invite, thank you, yep. Next I'll invite Kristine Russell up. Kristine will discuss the lessons learned in developing a patient-led grant, a grant called Impacts of Engaging with Patient Advisory Councils on Long-Term Recovery for Sepsis Survivors and Their Families. Kristine Russell is a sepsis survivor and the mother of a sepsis survivor, and both her and her daughter have struggled with repeated medical trauma from long-term health sequelae. Kristine sits on several patient advisory councils, including Patient Family Advisor with Alberta Health Services, BC Action on Sepsis, Sepsis Canada, to name a few. Kristine is the Marketing and Communications Program Manager at Sepsis Canada and has combined her expertise and drive in patient advocacy, patient quality improvement, and patient engagement. Today, as I said, she'll be talking about experiences and lessons from her grant writing.
I have a lifelong learner on the floor, so bear with me. My name is Kristine Russell, and as Osama mentioned, I am a sepsis survivor in 2014. I had postpartum sepsis after the birth of my third baby, who also was diagnosed with neonatal sepsis due to group A strep. For any pediatric sepsis researchers, clinicians in the audience, group A strep, GRIF, is a problem at this current state in our climate. And there are patients right now in the last little while that have had some severe impacts from invasive group A strep. I have my counterpart, Fatima Sheikh, up here. She's going to do some of the presentation with me today as well. And our project, as Osama mentioned, is a case study characterizing the impacts of engaging with patient advisory councils on the long-term recovery for sepsis survivors and their families. I'm presenting on behalf of our team, and it is, oops, that's the wrong button. Okay. And I'll give a little bit of context around the grant that this was put together. It was a grant call put together by Sepsis Canada to support patients and families. Sepsis Canada offered a one-time grant of up to $25,000 to eligible members of Sepsis Canada's Patient Advisory Council. This competition provided patient partners the opportunity to work with Sepsis Canada researchers to apply leading-edge science to advance a research project. The project began on April 1st, 2023, and there's an expected duration of 18 months. So he's behaved the entire time we've been here, so. And of course he's gonna do this now. So I'm gonna give a little bit of background. I probably don't need to go into the impacts of sepsis. We've been here for the last day and a half, so everybody kind of understands that part of it. But I do wanna highlight the long-term impacts for sepsis survivors. And again, we have talked about that a little bit over the last day and a half. Around the disability and psychological sequelae that sepsis survivors face. And furthermore to that, our Patient Advisory Council is composed of not only patients that have experienced sepsis firsthand, but family members and caregivers of those who have experienced sepsis and the family impact of those family members. And the presentation before really highlights that patients suffer severe psychological and emotional distress, including PTSD, and I think I'll take it a step further, and the term now is used PTSI, so post-traumatic stress injury, is kind of a more commonly termed than PTSD. And then what drove us to put this grant together was there was a necessity of understanding about those unique and persistent challenges for sepsis survivors and their families. And so we needed to find that those influences, the influencing factors for long-term recovery. So a little bit of background around patient engagement. I think as we've all heard over the last day and a half, is that patient engagement is pivotal for research quality and clinical care. It empowers patients and aligns outcomes with their priorities, facilitates knowledge sharing within communities, not just within the sepsis community, but as we've also heard, sepsis is a cross-cutting theme across all health issues, cancer, diabetes, all of those other sort of health issues. Patient advisory councils have also become increasingly relevant in both health quality improvement hospitals. As Osama mentioned, I sit on a provincial health advisory board for Alberta Health Services, focused primarily on quality improvement, but the advisory council work has kind of really shot into the forefront now, and looking at that into a research context, we really wanted to see sort of what does that look like for the experiences of those patients that are involved in that. As patient engagement evolves, evaluation tools are essential for improving that quality research and impact. So I'll invite Fatima up to go through the next couple slides.
I'm not as cute as the dog, so this makes me a less than fun counterpart. So I'm just briefly going to describe a little bit more about the details surrounding the project. So as Kristine mentioned, we're really interested in understanding the impacts of engaging with patient advisory councils on the long-term recovery for sepsis survivors and their families. We've seen a lot of uptake of patient advisory councils in health authorities and now in research networks, but there's less rigorous evaluation to see whether or not these advisory councils are actually effective in the way that patient partners would like them to be. And so this component is quite important. And so when we put in this grant, the first aim was to think about conducting a scoping review to identify a framework for evaluating patient partner engagement and patient advisory councils. So trying to understand whether or not any frameworks had been developed, any tools had been developed, and whether those could be adapted for our purposes. And then in using that, aim 2 was to explore the experiences of patient partners engaging in patient advisory councils using a mixed methods approach, recognizing the nuance that would be necessary to capture through qualitative studies, and characterize the impact on patients' long-term recovery. And that was a really long discussion to think about what long-term recovery meant. And part of this project is thinking about what that means as defined by the patient partners that are involved. In saying this, when we put in the PPRS grant and we were thinking about scoping reviews, there was less of an understanding of what was out there, and we thought a scoping review would be appropriate. But as we started to delve into the literature and trying to understand the landscape of patient engagement, we quickly realized that initiatives like SPORE and other initiatives that have been that have popped up as a result of SPORE have facilitated the development of several robust tools and frameworks for evaluating patient engagement. And in fact, there was a fantastic review that I'll describe briefly done out of McMaster by Dr. Julia Abelson and other members of the group that was commissioned by SPORE. And so what we really wanted to do was to think about what that review had done and how we could potentially build upon that rather than start something from scratch. And the objectives of the review are really similar to the scoping review in that we wanted to identify tools and frameworks for evaluating patient and family partner engagement. And this would be used to inform our survey questions, our interview guide, and our data analysis strategy. And again, as I mentioned before, this is a mixed method study, so we're looking to collect quantitative survey data to gather baseline information, interviews to explore experiences in depth, and this would really be a sequential approach whereby the quantitative data would inform what we would be looking at qualitatively. So as I mentioned, when we started to look at the literature to try and understand the landscape of tools and frameworks for patient-partner engagement, we identified a review that was done and published in 2018, but the searches were done in 2016. And they did a fantastic job of identifying 27 tools for evaluating patient and public engagement in research and health decision-making. So it wasn't specific to just research settings, but also, as I mentioned before, like provincial health authorities and other settings. Most of the tools aim to enhance engagement, but lack scientific rigor and patient input in their design and reporting. And I think what's really important to flag here is that even though this was published in 2018, the searches were done in 2016, which to me seems relatively recent. There has been such a significant uptake in patient-partner engagement tools, evaluation frameworks, that it actually warrants an updated systematic review. And this was identified by the authors really early on, some of whom have gone on to create their own frameworks and tools. So it's necessary for us to evaluate all of that. So, as I mentioned before, I'm going to talk a little bit about more of the data collection strategy as we've proposed it, recognizing that this may very well change following the results of the systematic review, which are now in progress. But briefly, we're thinking to collect quantitative data on patient engagement experiences. We're looking at 2 different advisory councils, so characterizing those advisory councils and contrasting that with the experience of individuals in each of those advisory councils. And that will inform the interview content and allow for broader insights. And then certainly recognizing that, in those different experiences, we wouldn't be able to capture the nuance and the richness that might be necessary to answer these research questions. We're looking to do in-depth interviews on the personal experiences to explore some of those nuances that we might identify early on in the quantitative study. I'll pause there in terms of, talking a little bit about the methods that we're hoping to use, but I think critical to this kind of work, and something that we're seeing a lot now, more in health research, is this component of integrated knowledge translation. This project is led by Kristine and a number of other patient partners, and so it's been a really collaborative approach involving patients, researchers, and clinicians, and really flipping the script in the sense of, the patient partners are identifying the questions and leading the work, and the researchers are there more to support and follow suit and follow their direction. In saying that, while we've engaged 2 different patient councils, the work goes well beyond that, right? So thinking about who in the patient partner space, SPORE initiatives, what are they doing and how do we bring that back to the critical care space? So the integrated knowledge translation has already started, even in the developmental phases. And the hope of all of that is that it centers patient-identified research priorities and really enhances the relevance and impact of the research. I'm going to pass it back to Kristine, who'll talk a little bit about the outcomes.
And I might whip through this quick because we have to be across the street at now for the Café Scientifique that's happening. So as you can imagine, the list is long for expected outcomes of this. And again, they also may change as we move forward in this. But what we really hope is to get rich insights into sepsis survivors and families' engagement experiences, understanding the impact of engagement on long-term recovery. And I think one of the things that we did identify and one of the things that did come up in discussion was actually defining what is long-term recovery for sepsis survivors, because I don't think that that's actually been well defined from a patient and family perspective. And looking at that in both adult and pediatric populations, it may come out in all of this. Identification for areas of improvement in patient advisory councils, define long-term recovery for sepsis survivors. Assess the impact of advisory council engagement, which will then help drive the need for advisory council work in both research and quality improvement. This is not just going to be applicable for sepsis, and this is one of the things when we put this grant in, was that this will be broadly applicable to not only other critical illnesses, but likely other advisory council work within research, in a research capacity. We can hopefully look to develop resources for patient-oriented research, keeping in mind that we are constrained by time and constrained by budget. And then also contributing to patient-oriented care and improved outcomes. And I'll flip through this quick because it also ties into the last slide. But the implications of this, obviously there was 2 branches of this, clinical practice and research. It can help inform patient-centered care approaches, enhancing survivor outcomes. In the research capacity, improving research quality through patient insights, and driving patient-centered research priorities. And I mean, that was something that was touched on by the previous presentation by Winona and Kristine. That advisory council insight, and something that SPORE has highlighted, and CIHR highlights in all of their grant calls, is having patient partners on their grants. Is really important, having patient partners embedded in their research early on to help inform, patient-led outcomes. And hopefully what we do here can help provide insight to what that looks like. Future directions, again, this list is probably a lot longer in my head than what it is on this slide. Disseminations of finding to healthcare providers, researchers, granting agencies like CIHR and SPORE, and policymakers. And in the sense of policymakers, we talked a lot about policy here today, but policymakers and healthcare authorities and hospitals, where they are putting together advisory councils, and advisory councils in a hospital setting or in a healthcare advisory setting, policies are tied to all of those things. And so if there's recommendations that are put forward from this that can sort of facilitate what do advisory councils need to look like in those settings. Potential refinement of patient engagement strategies, which can help facilitate some of the work that SPORE does. Further exploration of patient engagement's role in other medical contexts, again, in that advisory councils, and not at the hospital level, but agencies like PHAC, CIHR. And lastly, I just would like to thank Sepsis Canada for providing this grant, the steering committee for their support of the patient-led grant call. We did have support, and I need to acknowledge, from UBC's Action on Sepsis Research Cluster, Texas still here, I think, and the Michael Smith Health Research BC Support Unit also gave us a letter of support for this, which is tied to SPORE. And again, CIHR, who funded Sepsis Canada's network, which was able to provide us with this funding. And of course, last but not least, the Sepsis Canada and Action on Sepsis Patient Advisory Councils. And anybody has questions if you're quick? And one more shameless plug, the cafe is open to everyone here if you do have time to walk over. The registration starts at 4:30, which that's why we need to go. And we do have keynotes. We have a panel with patient partners. It will be hosted and moderated by CTV's Avis Favreau and Dr. Blair Bigham. There is food also. And so we are lighting the Hamilton sign pink for sepsis awareness. So hopefully you can join us. No questions. That's great. But you can ask questions.